Alhamdulillah. Bismillah. This video is an explanation of practical 2. Explanation of practical 2 related to inflammation and tissue repair. Okay. So these are the cases we are going to see. Okay. First slide is acute appendicitis. This is the most common example we teach students in related to acute inflammation. I can say it's all over the world. So it is so common, so we teach this as the best example to teach acute inflammation. Okay. So acute means, which means something happening very fast, rapid, short duration of time, rapid and short duration of time, and itis means you all know it is inflammation. So this is acute inflammation of an organ called appendix. Okay, so appendix is a intestinal organ, okay, which is at the junction of the ileocecal. Okay, and this appendix, when it gets infected, or most of the times we don't know the cause of the infection. If it goes for inflammation, what is the first step involved in acute inflammation? The first step involved in acute inflammation is vascular changes. What happens in the vascular changes? So there is vasodilation, followed by increased vascular permeability, which leads to edema. When the when the organ is going for edematous, it will swell. Okay, so the appendix looks swollen and edematous. Okay, and it is red in appearance because of the vasodilation. Okay, so the blood vessels inside the appendicular wall, okay, so which is in this just in the serosal layer, above the serosal layer, it goes for vasodilation, so the appendix looks red. It is called inflamed. Okay, so it is swollen and edematous specimen of appendix. Okay, and when we see this is normal slide, this is a normal cut section, microscopic section of the appendix. So if you see the acute appendicitis microscopic picture, you can see the lot of blue color areas, right? And this blue color areas is also involving the muscular coat of the appendix. Okay, small dot blue color areas. So this is all the inflammatory cells and the appendicular lumen. Okay, it is filled with some tissue fluids and inflammatory cells, and there is ulceration of the appendix. So if I keep this slide, you should write it as acute appendicitis. If I keep this slide, you should also write it as a acute appendicitis. If I ask you to describe about the specimen, you should write it is a acute appendicitis gross specimen. Gross means naked eye appearance. Okay, it is swollen and edematous due to acute inflammation. So to differentiate the acute and chronic inflammation, I am taking the inflammatory disease of the lung. Okay, so before going to that, I will explain something about histology of the lung. So this is the lung. Okay, and lung gets the tubular structure of the trachea. It divides into bronchus, and it comes in, divides into bronchus and left and right bronchus, and the bronchus divides into bronchioles, primary, secondary, and tertiary bronchioles, and they all end up in alveolar sac. They all end up in alveolar sac. End up with alveolar sac. So what I am going to do is just I am going to cut a piece of this lung and I am going to see under the microscope. If I see under the microscope, this lung has lot of alveoli. Alveoli are the small balloons, okay, bags, okay, and this lung tissue contains alveoli, okay. So you concentrate on the alveoli and the other parts which I am explaining. Inshallah we will discuss more in the respiratory module. These alveoli are lined by a epithelium called alveolar epithelium. Okay, we have type 1 and type 2 epithelium. Type 1 epithelium is flat and type 2 epithelium is columnar. So we have two types of epithelium. Okay, flat epithelium and the columnar epithelium. All the lung alveoli are lined by this epithelium. Okay, this is what alveolar epithelium. Okay, all the epithelial cells has nucleus. Understand? This is what alveolar epithelium. This is what alveolar epithelium. This is what alveolar epithelium. There are two types of epithelium. One is flat, other one is little bit columnar. Okay. We have two types of alveolar epithelium. Okay. So, what is the main function of the lung? The main function of the lung is to do the gaseous exchange. That is, the blood vessels bring the carbon dioxide, that is deoxygenated blood. Then the carbon dioxide is thrown out and it takes back the oxygen. So this alveoli bag brings the air. Okay, when it brings the air, it has to be surrounded by the capillaries. Okay, the capillaries I am drawing in blue color. Okay, so lung is covered by capillaries. Okay, the lung alveoli are covered by capillaries. Okay, very thin capillaries. Listen, they are covered by very thin capillaries. Understand? They are all covered by very thin capillaries. Understand? So this is capillaries. We call them as pulmonary capillaries, and this is all alveoli. Okay, this is all alveoli. Okay, this is all alveoli. Okay, so the space between the alveoli and the space between the alveoli, okay, and this capillary and this capillary, okay, and this capillary, the space between the alveoli and this capillary, I am drawing in green color. Okay, the space is so thin. Okay, this thin space is called interstitium, pulmonary interstitium. See, this pulmonary interstitium is so small, even in the microscope, it is difficult to see. Okay, we have to see the interstitium, means we'll go for electron microscope. In case if you see the interstitium, then there is some problem in the lung. Okay, when I see the interstitium, okay, the space between the capillaries and the alveoli is becoming more. Okay, then I will see what is there in the interstitium. If the interstitium is full of fibrosis, for example, this is the alveoli, this is the alveoli, and this is the alveoli. See, it's a air sac. Okay, see, it is lined by a epithelium. It's lined by the epithelium. Okay, this is all the epithelium. It's lined by the epithelium. So I told in between the alveoli there should not be any gap. There is interstitium, but it is very thin. Here the interstitium is becoming very big. So what is there in the interstitium? See, this is alveoli. Okay, what is there in between the interstitium? There are fibroses. Okay, so what is this? This is fibrosis. Okay, and you are seeing lymphoid aggregates full of lymphocytes, and if you see lymphoid aggregates, that is fibrosis plus lymphocyte, what it is? It is some chronic inflammation is happening. Some chronic inflammation is happening. Understand? This is chronic inflammation of the lung. This is chronic inflammation of the lung. Now coming to the next picture, this is also alveoli, and this is also alveoli, and this is also alveoli. Okay, and the alveoli are very near. Okay, see, the alveoli are very near, and you can see in between the alveoli you are seeing some orange color area. Okay, this orange color area are the capillaries. Okay, so the capillaries are full of orange color because it is filled with blood. Okay, see here, it is filled with blood. Okay, so this is called congestion. Understand? See, why the capillaries are filled with blood? What is the first step in acute inflammation? What is the first step in acute inflammation? Vascular changes. What is the vascular changes? The vascular changes are vasodilation and increased vascular permeability. So this will leads to vasodilation, leads to congestion, that is orange color appearance. Okay, this is orange color appearance, that is full of blood, and when the blood comes, the fluid escapes. So the fluid goes into the alveoli, and the next change is cellular changes. Cellular changes, what happens? They bring the neutrophil. What you are seeing inside the alveoli is full of neutrophil. See, this alveoli is completely full of neutrophil. This alveoli is full of neutrophil. Okay, the alveoli is surrounded by the congested capillaries, and the fluid is escaping out, and the neutrophils are coming out. It is a acute inflammation. This is called, this changes leads to acute inflammation. Okay, if this is the case, if the person gets some bacteria and it is going for acute inflammation, and the alveolar sacs has to be very much empty, so the air can come enter easily and go out freely. But if it is filled with fluid, it is filled with neutrophils, it is completely occupied, the alveoli is full of something, it leads to difficulty in breathing. And because of the fluid and the increased secretion of the bronchial glands, we get sputum and cough. When the sputum comes, if you see that sputum in the microscope, and if you see lot of neutrophil, that is the evidence of acute inflammation in the lung. Okay, next case is lung abscess. Lung abscess is nothing but it is severe form of acute inflammation, because in the acute inflammation the pus is formed, the pus collected more, and it forms the abscess. So this is the abscess. These are the areas of abscess. Okay, the lung is going for abscess. Okay, so when the lung goes for abscess, if you see these areas under the microscope, the area near to the abscess, you will be seeing the same acute inflammatory changes, and that is the area seen next to the abscess, because the abscess is full of what? Because if you take the abscess and see under the microscope, it will be full of fluid, proteins, neutrophils, degenerated neutrophils, okay, I will write properly. Fluid, proteins, what is that? Plasma proteins, and we have neutrophils. The neutrophils come and take the bacteria and they also die, so it will be of degenerated neutrophils. The neutrophils, and I forget this. Okay, degenerated neutrophil and the bacteria. Okay, the bacteria may be live or dead. Okay, so this is the pus. Okay, so too much of pus collection is called abscess. Okay, so if you take the abscess, what you will see, you will be seeing this one, right? And the dead tissues also will be seen. So these are the things you will be seeing. So you cannot identify what is happening, only you can say that it's a pus. But if you take the neighboring area and you can see what is happening in the neighboring area, it is a acute inflammatory changes. Understand? So it is the lung abscess. If I keep this slide, you have to write it is a lung abscess, and if I mark this one, you should say it is a necrotic debris, which is a collection of a necrotic debris. It's a pus. It is collection of pus is called abscess. Okay. Next, you all know about granulomatous inflammation. Why the granulomatous inflammation comes? For example, the best example to study the granulomatous inflammation is tuberculosis. In the tuberculosis, what happens? Okay, the tuberculous bacteria, that is Mycobacterium tuberculosis, comes, and what our macrophages do? Our macrophages take this bacteria. Okay, then they will become activated macrophages. Activated macrophages has large nucleus, and they will release IL-12. This IL-12 will activate T lymphocyte, and the T lymphocyte will release interferon gamma, and this interferon gamma go to the blood vessel. Okay, they go to the blood vessel and they bring what? Monocyte, and the monocyte comes out and it will become as a macrophage. Once monocyte comes out, they will become as a macrophage, and the macrophage is directly activated by the interferon gamma. Okay, then they will become activated macrophage. Again they will release IL-12. So this will start as a cycle. In the end, they will produce center caseating necrosis. Okay, and surrounded by macrophage, activated macrophage, otherwise called as epithelioid cells, and T lymphocytes, and all the activated macrophage join and they form what? Multinucleated giant cells. So this is the multinucleated giant cells, and you are seeing a somewhat large cells here. Okay, these large cells are the epithelioid cells, and this is the Langerhans giant cell, and the center area, this 2 is the caseous necrosis, cheese-like necrosis. This is the necrotic area. This is the lesion. Okay, so this is a case of tuberculosis granuloma. This whole structure is called as granuloma. So if I mark this one, you should say it is a tuberculosis granuloma. If you mark the center area, you should say it is a caseous necrosis. If you mark the giant cells, you should say it is a Langerhans giant cell. If you mark this large plumpy cells, it is a epithelioid cells. This is a case of granulomatous inflammation in tuberculosis infection. So don't worry about this slide. Inshallah, we will discuss this slide in the other modules. So now coming to the tissue repair. What type of scar it is? What type of repair it is? It is a scar formation, because the injury went to the dermis. Okay, here you just follow this scar. Okay, and if you follow this scar, this side the scar is a normal scar. Here if it comes, there is the depth of injury is little bit more than this area. here the depth of injury is more, so it is producing contraction, it is producing fibrosis. So this is the scar formation and this is the fibrosis formation. The fibrosis leads to contracture. So here the extent of injury is very big and it produces contracture. So if I keep this picture, you should write what type of tissue repair it is. You should write it is fibrosis leading to the contracture. Okay, here if I mark this one, you should write it is a scar. If I mark this one, you should write it is a fibrosis leading to the contraction. Okay, so this slide inshallah we will be discussing in the other module. So this is very important slide. So this is called liver fibrosis. Severe form of fibrosis is called cirrhosis. See, liver is a powerful organ, as I told you earlier in the class. When the liver goes for damage and it goes for fibrosis, the surrounding liver cells will proliferate. Okay, surrounding liver cells will proliferate. When the surrounding liver cells proliferate, they form a bulge surrounding the fibrosis. If that bulge is called nodular, okay, which is nothing but proliferation of the liver cells. So you can see small nodules, right? If it is very small, it is called micronodular cirrhosis. If you see large nodules like this, it is called macronodular cirrhosis. The concept here is, once the liver goes for damage, the surrounding hepatocytes will start proliferating, because normally they are quiescent cell. They will not divide, but there is necessity, then they will start dividing. Okay, so that is called macronodular cirrhosis if the nodule is large. If the nodule is small, it is called micronodular cirrhosis. If I keep this picture and if I ask what it is micronodular cirrhosis. If I keep this picture and if I ask what it is, you have to write macronodular cirrhosis. Okay, this is the normal liver. Most of the times I will not keep the normal slides. Okay, what is happening in this liver? Acute inflammation. Okay, acute inflammation, because once anything comes, it starts with acute inflammation. Then if it cannot be removed, then it will go for chronic inflammation. Chronic inflammation leads to fibrosis. These pink color balls are the fibrotic bundles, okay, surrounded by the liver cells. Understand? So this is the characteristic feature of, okay, so this is the nodules and you are seeing the fibrosis. Understand? So this is the chronic inflammation leading to fibrosis. Okay, so if I keep this slide, you should write it as a chronic inflammation leading to fibrosis. Okay, and if I keep this slide, you should write it as a micronodular cirrhosis. If I keep this slide, you should write it as a macronodular cirrhosis. This ends the practical of inflammation and tissue repair. Okay, just a color here. Assalamu alaikum.